Hello everyone and welcome to the Mental Health and Suicide Survey Media Briefing. My name is Elke Thompson and I am the producer for today's event. Before we get started, I would like to go over a few items so you know how to participate in today's event. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. You will have the opportunity to submit questions during our discussion sessions today. To ask a question, please raise your hand by clicking on the hand-raising icon located at the top left of your GoToWebinar control panel. If you have joined the webinar by telephone, please enter your PIN number, which can be found in the audio pane of your control panel, so we may unmute your line and you may ask your question. If you prefer to type your question, you may submit your text question through the Q&A section of your attendee control panel. We will collect all questions and address them during the Q&A session at the end of today's presentation. If you have a technical question, you may type your question through the Q&A section of your attendee control panel, and I will respond to your question. You may also contact GoToWebinar technical support by dialing 888-259-8414. I would now like to turn the call over to Sharon Reese, who will be moderating today's call.
Hi everyone, welcome and thank you for joining us. For today's call, we have brought together an expert panel to provide the most recent information and insights into America's views of suicide prevention, understanding of the risks, warning signs and causes of suicide, as well as anxiety disorders and depression as risk factors for suicide. We have with us Dr. Mark Pollack, President of the Anxiety and Depression Association of America, and also Granger Professor and Chairman in the Department of Psychiatry at Rush University Medical Center in Chicago. Dr. Christine Motier, Chief Medical Officer of the American Foundation for Suicide Prevention, and Doreen Shervin, Executive Secretary of the National Action Alliance for Suicide Prevention and Vice President and Senior Scientist at Education Development Center, Inc. So before we get started, we wanted to review with you the purpose of the survey. The Anxiety and Depression Association of America, American Foundation for Suicide Prevention, and the National Action Alliance for Suicide Prevention joined together to field a national consumer survey with the goal of assessing perceptions about mental health and suicide awareness, knowledge gaps, and opportunities for action. To do so, the three groups commissioned Harris Poll to conduct this survey on mental health and suicide. The study was done online within the U.S. On behalf of the three groups between August 10th and 12th of this year among 2,020 adults ages 18 and older. I would now like to turn the call over to Dr. Pollack, President of the Anxiety and Depression Association of America, who will kick off the presentation of the survey findings.
Well, thanks, Sharon. As Sharon mentioned, in doing this survey, we were interested in understanding mental health and suicide awareness, knowledge gaps around that, some of the barriers that might interfere with people seeking help or treatment, and opportunities to motivate action and to do better. We did get what might be considered some positive news from the study. Overwhelmingly, people say that they value mental health as part of their overall perception of their general health and well-being. Nearly 90% of Americans value mental health and physical health equally. So a recognition that mental health is an important component of their well-being. We found that people, in particularly younger adults, are becoming more comfortable with mental health conditions, and that speaks well, hopefully, to the future in terms of people recognizing the importance of mental health. However, what's of concern is that there are still perceptions and stigma around mental health care that almost certainly are obstacles for receiving care and effectively treating mental health issues. In this survey, in our survey, we found that 40% roughly, 38% of Americans recognized seeing a mental health professional as a sign of strength. However, turning that around, that means that over 60% did not. So while some evidence of decreases in stigma, still an awareness that a lot of people see seeking treatment as a sign of weakness. In addition to those issues around stigma, 43% of Americans view mental health care as something that most people can't afford. So there's a recognition that access is tough because of financial issues. 30% don't think it's accessible to most people, and 30% thought it was not something that most people knew how to access. So strong evidence that stigma is still an issue in preventing some people from seeking help, concerned that it's a sign of weakness, and that even among those who might seek help, financial issues and just figuring out the mental health system remain barriers to seeking care. We see this same theme, if you will, of lack of access reflected in people's own actions. When we looked at conditions people self-identified with, close to half have thought that they had a mental health condition, yet only about 40% or so had received treatment at all. And even fewer reported seeing a mental health professional in the last year. So recognition that many people are affected, but only a minority, if you will, are getting the kind of help that they might benefit from. People are also looking beyond traditional treatments, such as individual psychotherapy or medication treatments, to other sorts of treatments like peer support and coaching. And we need to do more work in the field in terms of understanding the relative benefits of those treatments and trying to figure out who may best receive them. While psychotherapy and medication are still the most frequently used, the majority of respondents reported that all treatments were somewhat helpful. In addition, in this survey, we also looked to understand risk factors for suicide. Many people understood some of the risk factors associated with suicide, but there were other important ones that were unrecognized. A need, clearly, to have a greater understanding of the risk for suicide. The majority of people recognize that both life circumstances, stressors and so forth, as well as mental health conditions affected an individual's risk for suicide. Many people understood that depression and post-traumatic stress disorder, whether in civilians or in military personnel, can increase the risk of suicidality, but less than half recognized that anxiety disorders also put individuals at risk. And this is an important issue because anxiety disorders are among our most prevalent conditions, affecting upwards of a quarter of Americans at some point in their life. And there's really compelling evidence from studies involving thousands of patients that demonstrate that individuals suffering from anxiety disorders are clearly and unfortunately at increased risk for suicidal ideations and attempts. For people who have mood disorders like depression, having a coexisting anxiety disorder or significant anxiety symptoms as part of their depression presentation also markedly increase the risk of suicidal behavior. We have effective treatments for these conditions, and providing care for risk factors like depression, like PTSD, and importantly, like anxiety disorders are going to be important as critical pathways to reducing suicidality.
Okay, and now Dr. Mottier from the American Foundation for Suicide Prevention.
Thank you. We are very encouraged by the survey results, which did show that progress is being made in terms of how American adults view mental health as an equal priority to physical health and the importance that mental health plays in our everyday life, our functional roles at work, at school, at home, and in our relationships. And I'll just add that I think what is happening is that people are beginning to understand that at the core of mental health and the roots that drive what make up a person's mental health are actually quite similar to those same roots that comprise physical health. That is, with mental health, it's brain health, it's health in the body, and it's also the psychosocial events going on in a person's life that drive a person's mental health at any given time. And that same combination of brain, body, and psychosocial events also plays into physical health. So I think a greater understanding is occurring among the American people, which is very encouraging. When it comes to treatment and prevention, we are also encouraged by the survey findings that show that American adults want to help a loved one who may be in distress by connecting them with the right mental health treatment and support. This is really important because we know that 9 out of 10 cases when a person dies by suicide, they actually had a diagnosable mental health condition at the time of their death. The survey also found that American adults want to have better access to mental health care. They do view the mental health care system as inaccessible and costly, and those are some of the barriers. So moving on and just focusing on prevention, the survey also found a very encouraging finding that 96% of American adults think suicide is preventable. Now, the survey also found that 55% of American adults have been personally affected by suicide in some way, and that was in terms of whether they had known somebody who had died by suicide, had known somebody who had a suicide attempt, or had disclosed suicidal thinking to them. So that was 55% of American adults. Most people, 67%, also said that if they were personally having thoughts of suicide, they would tell someone in their life. Now, the one area that we know we need to do more work on is with regard to our men in America. Men in our survey were significantly more likely than women to say they would not tell or reach out to anyone if they were contemplating suicide. And this is very important because our highest rates of suicide in our country are among our middle-aged to older white men in particular. Now, when it comes to American adults' knowledge about what can make a difference for preventing suicide, this was also quite encouraging. Nearly 9 in 10, or 89% of American adults, think that we can reduce the number of people who die by suicide. And they appropriately identified things like better access to treatment, better training for healthcare professionals for people who are at risk for suicide, and also more research. A greater investment in research can amount to reducing suicide. Now, I just want to make the point that when it comes to research and what it has to do with its ability to reduce our nation's rate of suicide, what we've seen for other leading causes of mortality in our country is that, for example, over the past 10 years, there was a significant fiscal investment in research when it came to HIV/AIDS, heart disease, and prostate cancer, and the mortality rates due to those conditions were reduced significantly. In the case of HIV/AIDS, it was by 53%, for heart disease by 29%, and for prostate cancer by 14%. So that investment in research does pay off in terms of a reduction in mortality rates. During that same period of time over the past 10 years, the suicide rate has increased over 20%. So we do have every reason to believe that if we invest in suicide prevention research, we will make the same impact in lowering the suicide rate.
Okay, thank you, Dr. Mottier. Now we're going to turn it over to Dr. Shervin.
Hello. I wanted to speak a little bit more about the notion of suicide risk and Americans' understanding about suicide risk And we, like Dr. Moutier said, are very enthusiastic about the American public's understanding that it is mental health problems, life situations, and certain physical problems that might come together that increase a person's risk for suicide. Let me start with mental health problems. As Dr. Pollack said, we do know that, or that American adults say that 79% say that depression increases risk, PTSD increases risk, and we have more work to do around helping the American public understand that anxiety contributes to the risk of suicide. American adults also understand that life situations really contribute to the risk of suicide, that feeling hopeless at 75% or being bullied increase someone's risk, but also looking at issues like financial problems or relationship problems or losing one's job also contribute to the risk of suicide. In addition, American adults understand that drug and alcohol use. 2 out of 3 adults understand that drug and alcohol use, as well as chronic pain and chronic health conditions, contribute to the risk of suicide. So to summarize this, it's really never one issue that increases a person's risk for suicide, but the mix of factors that we need to understand and intervene to help save lives. Next slide, please. When we asked American adults to help identify the barriers to seeking help if someone was thinking about suicide, what we found is that 74% felt that nothing will help, and that's concerning. But at the same time, I think it is in juxtaposition to the idea that 68% say that they don't, that they think people don't necessarily know how to get help. As Dr. Pollack talked about stigma, we know that embarrassment and social stigma continue to be barriers for people to seek help when they're thinking about suicide. And again, the affordability and access of treatment continue to be major issues when people are thinking about suicide. And these factors are imperative at this point in our understanding of what will help people in removing barriers. The affordability and access of treatment is something that is a major road that we are going on in this country. And then the last thing I would say about barriers is that we know that a lack of social support, social isolation is a major factor in suicide, and the American public reports about half of them understand that the barriers to seeking help include a lack of social support. And so, optimistically, I think this is a really important takeaway, that if someone close to them was thinking about suicide, 97% of American adults say they would do something. Almost all adults say that they would do something. This ranges from encouraging someone to seek help, and that might range from a mental health professional to a doctor or primary care professional, to a clergy person. 2 out of 3 American adults say that they would stay with someone until that person gets help. And the same number of people, 2 out of 3, said that they would help by calling or providing a crisis line number. So what this tells us is that people want to do something and are willing to do something, and that the more we as a field help them know what to do, the more likely they can play a role in helping to prevent suicide.
Okay, thank you, Dr. Shervin. And then back to Dr. Pollack, and he will wrap up our findings.
Well, thanks. So our organizations, the Anxiety and Depression Association, the American Foundation for Suicide Prevention, and the National Action Alliance for Suicide Prevention, we're pleased to kind of work together to assess Americans' perceptions around mental health and suicide. And I think in general, we're glad to see that Americans are now starting to recognize the importance of mental health as part of their overall wellness, and that they value mental health care. But with over 40,000 Americans every year killing themselves, over 40,000 Americans committing suicide every year, with over 20 veterans killing themselves every day, it remains of significant concern that many Americans don't seek help treatment, even if they think they may have a mental health condition, and that there are both barriers around stigma and then also institutional barriers around accessing treatment, being able to afford treatment, being able to negotiate the healthcare system to find treatment that interfere with individuals getting the kind of help that could quite literally be life-saving. Our three organizations are committed to working together to get people to seek help if they or a family member or a loved one has a mental health condition and is thinking about suicide, and recognize the importance of working with the public to decrease the barriers of stigma and others that impact ability to seek care. So at this point, we'll stop and be happy to take questions. So thank you.
Great. Thank you so much, Dr. Pollack. As a reminder, there are two ways that you can submit your questions. One is by raising your raise your hand icon on your attendee control panel, and we will unmute you so you can ask your question. Remember, if you've dialed in on the telephone, please enter your audio pin so that we can go ahead and unmute you. The other way is to go ahead and submit your question via text through the Q&A pane on your attendee control panel. This time I'll turn it back over to Sharon to see if we have any questions that have come in.
Okay, we have several questions that have come in. So we're going to, Dr. Pollack, if you can take this first one. As shown by the poll and research, mental illness is a risk factor for suicide, but which mental illnesses pose the highest risk? For example, are people with bipolar disorder at a much higher risk than those with anxiety?
The rates of suicide are associated with a number of mental health conditions, and the fact is that many of these often exist comorbidly. So, for instance, patients with bipolar disorder may often have significant degrees of anxiety that further worsen their risk for suicidality. And comorbid substance abuse. If you had to focus on a number of conditions where the greatest amount of risk of suicidality exists, they would be in mood disorders, so major depression or bipolar disorder. Anxiety disorders have, in many cases, a comparable risk associated of suicidality, and that would also include post-traumatic stress disorder. And the third major class, if you will, of psychiatric disorders with elevated rates of suicidality are substance abuse disorders, drug and alcohol abuse disorders. And again, it's critical to recognize that in most cases when people walk in the door seeking treatment or are out in the community, it's more common to find that they have a combination of conditions rather than a single disorder.
Okay, and following up on that one, Dr. Shervin, do you want to take this part? Did the survey find people are aware of the differences in terms of risk level?
So the question is, are people aware of the differences in risk level? I think that what the survey tells us is that people understand that there are a multitude, that there are a mix of risks, that there wasn't a sense of level perhaps, but that there are risks in the mental health arena, in that life circumstances increase risk, and having a chronic health condition or chronic pain or a substance use disorder also increase risk. So it is the interplay of risks that contribute to a person's overall risk for suicide.
If I can just add, this is Christine Moutier, if I can just add there that the American adults who responded to our survey actually did identify depression. 80% of respondents did know that depression is a significant risk factor for suicide. When it came to the other mental health conditions, it seems like there was less of an appreciation for the true role that anxiety disorders and substance abuse plays. And again, I'll just reiterate what both of my colleagues have been explaining, is that it is particularly a higher risk when those mental health conditions are co-occurring together. For example, somebody who's depressed who is also using substances, who may have anxious features or a comorbid anxiety disorder, and then is experiencing those life difficulties, such as financial stress or relationship problems.
And Dr. Moutier, can you answer this next question that we have? Younger people see treatment as a sign of strength. What new opportunities does that present?
It's a great question, and it's something that we're very encouraged by, that just like we've seen the shifts in attitudes through the generations, which you can look to other major changes in cultural beliefs and attitudes and norms, such as with the gay rights movement, that we saw a sequence of things happening, research and people speaking out, advocacy, changes in laws and in the workplace. And we saw those generational differences, and still do to this day. What we know when it comes to mental health is that the younger generation is more likely to seek help and to have a greater understanding that mental health is a very valid and real aspect of their health. Although I will say, I think our survey results actually were encouraging for all ages. It was pleasantly surprising. So the opportunity there is that with social media and other ways that information is shared these days, I think that is something that we as our organizations, but also an average citizen, can play a role in terms of raising that level of awareness. And then, of course, that younger generation is going to progress into the middle-aged and older generation before long, and those attitudes can spread and also be augmented by the efforts that we're doing very proactively.
Okay, thank you. Dr. Pollack, we have a reporter who's asking for clarification. In your remarks, did you say 20 veterans kill themselves every day?
Yes, actually it's about 22 veterans per day are killing themselves, which is certainly far more than have died in the last 5 or 10 years from direct military involvement. This has been an area of obvious concern to the military, the veterans, as well as to the country in general, and is an area of increasing study and attention. But it does speak to the importance of recognizing these risk factors is consistent with the data that we're seeing from this survey and others that suggest that people are often not seeking or getting the kind of help they need to prevent these kinds of tragic outcomes.
And this is Sharon. Let me just make one clarification too. Our survey didn't add data in that conversation. So you'll see in your embargo materials, we don't have new findings in that area to report on. Okay, so let me, Dr. Shervin, can you comment on this? I am wondering about the mental health parity law. How has that affected access to mental health care for Americans?
We are, it's a great question. We're very encouraged by the mental health parity laws, and what we're hoping is that the more that they become implemented and spread through throughout the states, that we're going to see more and more Americans feel that they have access and have real access to care, both physical care and for their physical and mental health conditions, and that it's that care is affordable. So without that, we would, I think, be very pessimistic. But all of the efforts and all of the continuing efforts in increasing mental health parity will help us be able to get people at risk and in distress in treatment as early as possible.
Hi, this is Mark Pollack. I just want to echo that and add to it that the parity laws are really a step forward. However, without enforcement of those laws, there continues to be institutional financial barriers for people seeking treatment. And unfortunately, the enforcement of parity laws across the country have been uneven. So it is functionally true that in many situations, the effective ability of individuals to use their insurance benefits in a way for mental health in a way comparable to physical health issues has not been realized as of yet.
Okay, great. And here's a question for Dr. Motier. Do you consider these findings good news or a step in the right direction in terms of mental health stigma?
Yes, absolutely. We've all been expressing our sense of encouragement with regard to the understanding of mental health, that the majority of American adults do have a greater understanding, a greater value in terms of their sense of what mental health is and how it matters in their life, that the greater demand that they want to improve access to mental health care, affordability, all of that says that we are in a different time than we had been not that long ago. And even when it comes to the topic of suicide, that so many American adults now say that, well, the vast majority would help a loved one in distress who's talking about suicide or risk for suicide, and that they themselves would speak out if they were suffering. All of those, I believe, are a reflection of this change that's happening in terms of increased awareness and stigma going down as again, when research sheds a light on what the roots of these behavioral syndromes and changes in mental health are, that they are, and what they are not, that I think that's what we're seeing is sort of a culmination of those efforts that have been ongoing. There certainly is still more work to be done, but I believe this does reflect a trend in the right direction.
Okay. I'm going to actually ask Stacy from Harris to begin to address this next question. would you mind sharing any specific findings about the U.S. Latino community mental health access, treatment, diagnosis, and suicide rates? So we can first, I'm asking Stacy from Harris to address what we have in our poll and what we don't have in our survey. So Stacy, if you could address that.
Sure. We do have Hispanics within the sample, obviously, because it is a national representative sample of the U.S. population. So we could, while we haven't yet, we can pull out some findings on Hispanics, but it would be only among the Hispanics surveyed versus where the rest of the survey results can be projected out to the U.S. population as a whole, because while we ensure that we have the correct number of Hispanics to make the survey nationally representative at a national level, the Hispanics in the survey are not necessarily representative of the specific Hispanic population. They're very acculturated, they're more highly educated, things like that. So we do have the ability to pull out results on Hispanics, but like I said, not projectable to the entire population.
Okay, thank you. And then Dr. Pollack, I'm going to address this next question to you. I'm reporting from California, where we recently read in the news about 4 suicides in 18 months at the California Institution for Women. I understand that these survey results don't specifically speak to incarcerated people, but these tragic suicides are statistically uncommon. How can we look at these survey results in light of these incarcerated women's suicides? Did you want to comment on that question, Dr. Pollack?
Sure. I think there are at least a couple of issues around that relate to the our findings. Number one, in California, certainly in Chicago, in New York, and a variety of other places, the prison system, the judicial system, has in fact become a kind of de facto mental health system. So here in Cook County Jail and the LA prison system and in New York and others, literally thousands of incarcerated individuals have significant mental health issues, and often the lack of access to adequate mental health services mean that they're out on the street and end up getting picked up often for relatively minor infractions, and then are entered into the judicial system. So the lack of access to mental health care in part drives patients with mental health concerns into the judicial system, and we get the kind of tragic outcomes you're alluding to. The second issue is that oftentimes prison and other prison mental health systems are often understaffed. They're taking care of large numbers of patients, and there often aren't the kinds of complete, comprehensive programming that might better serve the mental health needs of that population. And the kinds of deaths that you're alluding to really do help support the call for better services for that population.
Okay, thank you. And this next question is for Dr. Shervin. The poll found that American adults want to help, but they aren't sure what to do. Can you comment on these specific actions that you think people should take if they think someone is thinking about suicide?
Thank you. Yes. One of the findings that is very striking is that 50%, a little more than 50% of the survey, or the survey respondents talked about either knowing someone that died by suicide, knowing someone that has attempted suicide, or someone who has been thinking about suicide. So it seems it's very important to know that that affects that the distress any one individual feels or is like sonic waves out that affect all the other folks that interact with them and that love them. So what is it that people can do? people in the survey have already talked about knowing to reach out to mental health providers, to call crisis lines. We have very effective crisis lines for suicide prevention, to make sure that the person is not alone until they can get help. And to, I think what we want to know is in what circumstances is help best, what kind of help is best suited. And so that's where we need to, I think that's where some of the research efforts need to go. But I think the American people are already talking about the very effective ways in which they can help. And I think from a communication point of view, we want to be able to get out there what are the best treatments, what are the best places where somebody with severe suicidality needs to go, and always to be able to let them know that if they call 1-800-287-TALK, they will get the National Suicide Prevention Crisis line.
Okay, and that appears to be... Yes?
This is Christine, if I can just chime in for a moment. Loved exactly what Dr. Shervin was sharing, and it really can be summed up by thinking about the phrase talk saves lives. That if you're concerned about someone in your life, that rather than avoiding and kind of being fearful that you might offend the person by raising concern, it's actually the caring thing to do, and the vast majority of people will receive it that way, as a caring approach, to sit down and have a conversation with them and ask open-ended questions, and ultimately, if you believe they're at risk for suicide, to lead them to help. And again, the crisis line of the National Suicide Prevention Lifeline is 1-800-273-TALK, and leading them to a mental health professional or to an emergency room setting if it's urgent would be the right things to do.
Okay, terrific. Well, we'd like to thank everyone for joining the call today. If you would like to receive additional information or if you have additional questions for our panelists, you can see up on the screen to contact Tamara Moore, and she can get you what you need. Otherwise, thank you for joining the call today. We enjoyed the discussion, and there were some terrific questions.